A warm welcome to all. I am Mohammad Shamil Shakir.
I am Anjuna KG.
We are studying in BSc Nursing second year in Revati College of Nursing, Tirupur.
We have our own hospital named Revati Medical Center. The hospital comprises all the facilities and it is mainly focused on treating cardiac diseases.
Revati College and Revati Medical Center is owned by Dr. Ishwaramurthy sir.
Every year, September 29th, we celebrate World Heart Day. The theme of the World Heart Day, the year 2022 is Use Heart for Every Heart.
This year 2022 World Heart Day theme focuses on promoting the idea of utilizing the opportunity to have a broader outlook and approach towards the betterment of humanity, nature and itself to fight and curb the enormous mortality rate due to cardiovascular disease globally.
World Heart Day 2022. Every year, World Heart Day is celebrated on the 29th of September. This day was first announced by the World Heart Federation to make people around the world aware of cardiovascular diseases and heart health. With the global campaign for World Health Day, we should aim to bring people together in the fight against cardiovascular diseases and encourage them to follow heart healthy practices.
Acknowledge World Heart Day to create an international movement where people, families, communities and governments take part in action to take control of their own and others' heart health. The World Heart Federation is inspiring and guiding global action to promote heart healthy living through this campaign, which unites individuals from all nations and background in the battle against the burden of cardiovascular diseases.
Anatomy and physiology of heart. The right side of the heart receives venous blood from the body through the superior and inferior vena cava, which enter the right atrium. Blood flows through the tricuspid valve into the right ventricle. Blood leaves right ventricle through the pulmonary valve into the main pulmonary artery. The pulmonary artery divides into right and left pulmonary arteries to transport deoxygenated blood from the right side of the heart to the right and left lungs. The pulmonary arteries branch further into the pulmonary capillary bed, where oxygen and carbon dioxide exchange occur. The four pulmonary veins, two from the right lung and two from the left lung, carry oxygenated blood from the lungs to the left side of the heart. The oxygenated blood flows from the left atrium through the mitral valve and into the left ventricle and out through the aortic valve and into the aorta and to the body.
Cardiovascular disease. Cardiovascular disease in simple terms can be defined as diseases related to the heart or blood vessels. The cardiovascular system of the body is responsible for the transportation of blood throughout the body. The cardiovascular system is also known as the circulatory system. The main elements of cardiovascular system are the heart, veins, arteries and blood capillaries. If any of the elements of the cardiovascular system is not able to perform its function properly, the cardiovascular disease occurs. The failure of the cardiovascular system can result in the instant death. Heart valve disease. Valvular heart disease is when any valve in the heart has damage or is diseased. There are several causes of valve diseases. Peripheral vascular disease. Peripheral vascular disease is a slow and progressive circulation disorder. Pericarditis. Pericarditis is swelling and irritation of the thin sac-like tissue surrounding the heart. Heart failure. Heart failure, chronic progressive condition in which the heart muscle is unable to pump enough blood to meet the body need for blood and oxygen. Basically, the heart cannot keep up. Coronary heart disease, a disease in which there is a narrowing or blockage of the coronary arteries. Aorta disease, it is a type of heart valve disease in aortic valve disease. The valve between the lower left heart chamber and the main artery to the body doesn't work properly. Cardiomyopathy, an acquired or hereditary disease of heart muscle. This condition makes it hard for the heart to deliver blood to the body and can lead to heart failure. Arrhythmia. Arrhythmia is a condition in which the heart beats with an irregular or abnormal rhythm. Here, in this picture, we can see the normal blood vessels and the blocked blood vessels, and it is become narrow due to the plaque formation and each to be decreased blood supply to the heart. This condition is called atherosclerosis.
Risk factors of cardiovascular disease: age greater than 60, family history, race or ethnicity, male gender, high blood pressure, high blood cholesterol, smoking, diabetes, physical inactivity, overweight and unhealthy diet. Types of risk factors. Risk factors is divided into two: modifiable risk factors and non-modifiable risk factors. Modifiable risk factors: unhealthy diet, physical inactivity, hypertension, excess weight or obesity, tobacco use, abnormal cholesterol, raised blood glucose or diabetes. In non-modifiable risk factors: age, gender and family history.
Cardiovascular health refers as the health of blood vessels and the heart. Cardiovascular diseases are group of diseases of the heart and blood vessels.
Being physically fit is one of the key to keep cardiovascular diseases under control and managed.
Exercise helps strengthen the heart muscles, keeping BMI under control, reducing the risk of artery damage due to high cholesterol, high blood sugar and high blood pressure, avoiding the occurrence of heart stroke.
Different type of exercise have different effect in cardiovascular diseases.
Aerobic exercise. Aerobic exercise like brisk walking, running, swimming, cycling, playing tennis, jumping rope. Improve circulation, which results in lower blood pressure and heart rate. It helps in cardiac output, that it improves heart pumping. It also helps in managing diabetes. It is recommended to do the aerobic exercise at least 3 minutes per day for 5 days a week.
Resistance training. Resistance training helps in the case of obesity, people with big belly and lot of fat. Resistance training helps to reduce bad cholesterol and improve the good cholesterol. Working out with hand weight, dumbbells, weight machines, push-ups and chin-ups are the good resistance training. It is recommended to do the resistance training at least 2 non-consecutive days per week.
Stretching, flexibility and balance. Flexibility workouts such as stretching doesn't directly contribute to cope of cardiovascular conditions, but it helps to be flexible and free from joint pain, cramping and other muscular issues. And being flexible is an important part to carry out the aerobic exercise and resistance training. It is recommended to do stretching and balance workout every day before and after other exercise.
This day is World Heart Day, and every year World Heart Day is celebrated on the 29th day of September. This particular day aims in making awareness among the people about the cardiovascular diseases and the heart health. Also, it aims in bringing people together in fight against cardiovascular diseases and to encourage them to follow heart healthy practices. The World Heart Federation is inspiring and guiding global action to promote a healthy living in the battle against the burden of cardiovascular diseases. So, we are reached our conclusion of our video presentation. Here, we had seen about the heart-related diseases and the healthy heart practices that we should follow. Use heart for every heart. Use heart for humanity, for a world with equity. The availability of cardiovascular disease therapy and support varies greatly throughout the world. Use heart for nature, for the planet's health and yours. 7 million people each year die from cardiovascular diseases, with air pollution accounting for 25% of all fatalities. Each of us may make a unique contribution to a healthy planet. Use heart for you to realize your full potential. The risk of heart attack might be increased by psychological stress. our heart health is maximized when we refuse detrimental coping techniques and undesirable behaviors brought on by stress. So, as a healthcare provider, it is our responsibility to care the patient with cardiac disease by providing early diagnosis related education for better health. Thank you. Have a nice day.